lymphedema. I know most of you have seen at least once in your career about lymphedema. So how many of you have seen lymphedema in your career? Please raise your hand or put your answers in the chat box. Okay. Anybody else? Okay. See, okay. So let me share my slide. So this is also another nursing issues of palliative care. We have a lot of patients in lymphedema. So lymphedema is related to lymphatic system. This is also a connection of one of the is connected into the circulatory system. So what is lymph? We all know that lymphatic system is flows of lymph. So what is lymph? Any idea?
Participants can unmute and say their opinions.
We have only a few participants. So you can unmute yourself and talk. So lymph is a tissue fluid. It's an interstitial fluid. It's collected through the lymphatic capillaries, then enters in the lymphatic vessels to lymph nodes. Mainly, it contains protein, lipids, and water. So, sort of interstitial fluid. It's a clear fluid. It contains protein and lipids, but from the interstitial space, with the help of lymphatic capillaries, the fluids can absorb, and that lymphatic capillaries, the fluids will enter in the lymphatic vessels. So that is the flow of that lymph channel. So I'll come to later in detail. So what are the functions of lymphatic system? Anybody, what are the functions of lymphatic system? What are the major functions of lymphatic system? Prevention of infection. Very good. So trying to prevent. So one of the main function is lymphocyte development and immunity. So okay. Then any other points? Okay. So thank you for the answers. The first function is reabsorb excess interstitial fluid. This is the main function because so we know the lymphatic capillary, the lymphatic interstitial space will be collected some sort of fluid that we call it as lymph fluid. Okay, lymph. So that fluid, whenever the interstitial fluid is collected with lymph, the lymphatic capillaries, which is nearby that interstitial space, collected from the lymphatic fluid. That means that interstitial fluid from the interstitial space. Okay, so we can able to maintain our body well. So otherwise, if the lymphatic capillaries doesn't work well, anasarca will be there. The huge edema will be there. So there is a sort of maintaining function, especially in our cells, that tissues maintaining is well only because of the lymphatic system functioning well. And the second thing is transport dietary lipids. Okay, so in our intestine, small intestine, we all know that we lot of lactates. So there is two function is there. Is the transportation of lipids is also happening there. Okay, so that is the another function. The third one of you already said, lymphocyte development and immune response. So whenever the infections try to enter in our body, our lymphoid, that lymph cells, like lymph nodes, will be react to the that particular infections, the particular bacteria or virus. So that is this is one of the important function. So these are the three major functions of lymphatic system. So this is our circulatory system. So can anyone please explain this? I know in our nursing school onwards, we have learned this circulatory system. Can anyone please unmute yourself and explain this? Anybody? Please switch on your video. So this is our circulatory system. Try to explain, please. Nobody wants to explain? Okay. Then I will explain. So you can see that picture from the upper part of the body. We all know that from the upper part of the body, the deoxygenated blood will be collected by the superior vena cava, and the lower part of the body, the deoxygenated blood will be collected by the inferior vena cava. After that, what happened? From the superior vena cava and the inferior vena cava, the fluid will be, the blood, deoxygenated blood will goes to the right atrium first. Then with the help of tricuspid wall, that moves to right ventricle. From the right ventricle, it goes to, with the through pulmonary artery, it goes to right and left lungs. Okay, right and left lungs. So here the deoxygenated blood. So why that deoxygenated blood goes to lungs? For purifying blood. Okay. So after entering the lungs, the deoxygenated blood will be purified with the help of oxygen, and then the oxygenated blood, after purification, the oxygenated blood from the right and left lungs through pulmonary veins into left atrium. Okay, so from the lungs, there is a union of arterial capillaries and venous capillaries together here. Okay, within the lungs. So that the deoxygenated blood will be purified and then goes to left atrium through pulmonary veins. Okay, from the left atrium, with the help of bicuspid wall, it goes to left ventricle. From the left ventricle, so aorta was push the blood out and it goes on upper and lower part of our body. So this is our normal circulatory system goes. And in the upper side also, some sort of purification will be here. You can see that picture, the lower part and the upper part, the deoxygenated blood and the oxygenated blood, the union of arterial capillaries and venous capillaries is happening everywhere. Okay. So come to the tissues. Here, I already said the venous capillaries and the arterial capillaries is joining. Okay. So when they communicate each other, there will be a lot of fluid-like material passing into the interstitial space. Okay. So you can see that picture when the arterial capillaries and the venous capillaries is mixing together. So there could be there will be some sort of fluid loss is there, oozing out of fluid in the interstitial space, which fluid is absorbed by the lymphatic capillaries, which is colored in green. It is overlapping in the tissues. So wherever the tissues will, wherever the capillaries, the connection will be there, definitely the fluid, the liquid fluid will be there. So that fluid, the lymph fluid will be there. That lymph fluid absorbed by the lymphatic capillaries. Okay. So that is the pathophysiology, that from where to absorb the lymphatic fluid is. So from the interstitial space with the help of lymphatic capillaries. Okay. So what is lymphatic capillaries? So you all see it first. It's a blind end. It has a blind end. So wherever the lymphatic fluid is there, so lymphatic capillaries which is absorbed, and it is a single layer or overlapping endothelial. You can see that picture. It is overlapping into the cells. Okay, and more permeable than that the blood capillary. Okay, so it is more permeable, so it can easy to absorb. So little bit large the cells also. So what is lymph nodes? It is a small round or oval shaped things, and it around 600 to 700 lymph nodes in our body. Okay, so it's the length between 6 to 25 millimeters. Okay, it typically found in clusters. So you can see that picture, and the main function is receive lymph from many body regions. The main function of lymph node is to receive lymph from the many body regions, and lymph nodes are also found in the found individually throughout the body tissues. Throughout the body tissues, the lymph nodes are there, but in the pathway of lymph vessels, in between the lymph nodes is situated, because if there is any infections pass on that lymph vessels, so that lymph nodes will be restricting, will be again resisting the infections. Okay, so that is what the lymph nodes will be located along the pathway of lymph vessels. Okay. So come to the flow chart of lymphatic system. So from the interstitial space, the lymphatic capillaries will be absorbed from the lymphatic fluids. Then it goes to lymphatic vessels. From there, it goes to lymph nodes. And then again, lymphatic vessel, finally lymphatic trunk, and then collecting duct. Through the collecting duct, it could drain to subclavian vein. If the fluid is drained into the subclavian vein, it mainly pass on the circulatory system. Okay, so this is the flowchart of lymphatic system. So what is lymphedema? So we have learned about what are the functions of lymphedema. So what are the things are involved in the lymphatic system. So now we are going to learn about what is lymphedema. So it is the swelling of interstitial space as a result of lymph drainage failure when capillary filtration is normal. If there is a capillary filtration is normal, definitely the formation of fluid will be there in the interstitial space. Okay, so fluid formation is there. But if there is a damage into the lymphatic system there, what happened? From the lymphatic capillaries, the fluid will from the interstitial space, lymphatic capillaries will be absorbed from the lymphatic fluid. But if there is any damage in the lymphatic system, it's not able to move the fluid from the lower part to upper. So there is a chance of accumulated fluid in the interstitial space, then gradually form edema, that is lymphedema. Okay, so it is a swelling of interstitial space as a result of lymph drainage failure when capillary filtration is normal. If there is a capillary filtration is normal, there is a chance of accumulation of fluid in the interstitial space. So that is, we call it as lymphedema. So according to the International Society of Lymphology, it has classified into two, primary and secondary. So primary is a congenital lymphatic dysplasia, because congenitally, if there is a malformation of lymphatic system there is a chance of developing lymphedema. That is primary. And the secondary is anatomical obliteration of lymphatic system. So because of the disease or any problems, the persons will develop lymphedema after that. That is that we call it as secondary lymphedema. Secondary lymphedema again divided into two, non-malignant and malignant. So non-malignant persons can also develop lymphedema. Okay, not for all malignant persons. Non-malignant persons also has developed lymphedema. So what are the groups of patients can develop lymphedema for non-malignant? So one is trauma. So road traffic accidents or burns. So after that, if there is any major lymphatic lymphatic system, maybe lymph node that fracture or damage there is a chance of developing lymphedema in their affected area. And infections, frequent and continuous infection like cellulitis. This is also can cause develop lymphedema. And iatrogenic or surgery or radiotherapy. Surgery, if one person can develop any tumor in their breast. So whenever the surgeon remove the breast, along with that we remove the adjacent nodes. Okay, so that is the chance of developing. So there is no adjacent lymph nodes in their body to connect the lymphatic fluids to the upper body. So there is a chance of developing lymphedema for that patient. Again, radiotherapy. Malignant directly primary lymphomas directly affected in the lymph nodes can develop lymphedema and secondary recurrence. Okay, some metastasis patients can also develop lymphedema. So come to the diagnostic part. So how to diagnose? So whenever the patients come to you with the edema, you have to take a detailed history. Okay, So what are the things you should ask for the patients? So the first thing is there any unknown cause? Okay. And the second question is there disease related or trauma related? Is there any recent trauma or any accident, any that disease or any frequent infections? That things you have to ask them. And the third one is treatment. So any treatment, maybe radiotherapy or chemotherapy, all those things you have to ask. So after taking the detailed history, you can do the clinical examinations. Okay. So what are the things you can do in the clinical examinations? So there are 3 stages of lymphedema. The first stage is the swollen. So, okay, it's a pitting edema stage. So if you apply pressure on their edematous area, your finger pressure will be able to see there. Okay, that is the stage 1 lymphedema. So you can see, you can treat the lymphedema. When you see the stage 1 lymphedema, you can treat it well and educate the patient and educate the caregiver for how to prevent lymphedema and how to control lymphedema. You can able to teach the patient and the relatives. The second stage is the tissue become fibrotic and hardened. So if you are not treated in the first stage, definitely the tissues will be fibrotic and it could be hardened. And the third stage is hard and cartilage formation will be there. In the third stage, we are not able to control the lymphedema. So because there is a the cartilage formation will be there and very hard that skin folds is also there. So we can easily treat in the stage of stage 1 and stage 2. So, so only one sign which we have seen in lymphedema patient is stemmer sign. Stemmer sign is, so if the patient is having upper part lymphedema or lower part lymphedema, in the patient is having lower part lymphedema, you can see that picture. The proximal phalanx of the second toe skin, you are not fold. You are not able to fold. Okay. So normally we can able to hold the second toe proximal phalanx skin. But if the patient is having lymphedema, you are not able to pick up the skin. That is stemmer sign. So in case of upper limbs lymphedema, you can see that picture. In the middle finger, the skin, you are not able to fold it. So that is the stemmer sign in the upper limbs. So you can able to diagnose this way also. So these are the skin changes will be there in the patient is having lymphedema. The first one is orange peel skin. Like the first stage, you could see this type of skin. So we have learned about pitting edema stage. In this stage, if you apply pressure on that area, your finger point will be there. So you can identify whether it is the stage 1 or stage 2. The second stage, sometimes deep creases will be there. The third one is thick and hard skin, and sometimes cartilage formation will be there. So these are the other diagnostic methodologies for the patient is especially the patient is having first the anatomical, the primary stage. If there is an anatomical, not an anatomical obliteration, if there is a primary lymphedema there, from the breath itself, there is a malformation of lymphatic system there. We could assess these always. Soft tissue imagining MRI or CT, we can able to determine extra fluid volume, and lymph vessel imaging, we can able to detect any abnormalities there, and bioimpedance spectroscopy you can able to measure the interstitial fluid volume. But in palliative care, we are not doing all these things. We are only taking the good history, and along with that, we can do the clinical examination. Then we finalize the diagnosis. Okay. So we know if there is a edema there, we know we have to take a proper history. If the patient is having renal problems, is also having lower legs edema, so we have to evaluate well first. That is why I was telling about you take a good and detailed history about their disease condition. So come to the problems. So there are a lot of problems. We know one limb is normal and the another limb is huge because of fluid accumulations. Emotionally, socially, physically, and spiritually is also affected that persons, because day by day the fluid will be increasing, fluid load will be increasing, and the lymph weight and all things will be developing, and following that the patients will be affecting physically, emotionally, socially, and spiritually. So what are the things comes under physically? So these are the main problems that the persons will be affecting, especially pain. So fluid, because of the fluid volume, the skin will be stretching, and after that the pain will be developed. Okay. And they may feel discomfort. They are not able to lift their own limbs. Okay. So that is also affecting physically and emotionally, and impaired mobility. They are not able to move independently. They need support. Loss of functions. It will be affecting the that normal function also. Like, so they are not able to work independently. They always seek help for and the things that if they want to take one the things from the cupboard, they are not able to take it. So they depend others. So that will be affecting the person emotionally. So come to the psychosocial part, distorted body image. This is one of the major problem. Okay, so you can imagine one limb is normal, the another limb is huge. So we are nobody is willing to open their affected limb in the public. Okay, so this is so one major problem. And the second thing is loss of independence. I already said the loss of independence is also affecting the person psychologically, and loss or change of employment. This is also, they are not able to continue their jobs after the disease condition. This will be affecting emotionally, and difficulty in wearing clothes or shoes. So if they want to wear a ready-made clothes, so they are not able to wear it, and especially shoes. So in the lower leg lymphedema patients, they are not able to wear the normal shoe also. So that will be affecting the person emotionally and socially, and the anxiety, depressions. So they will be anxious about why this is why that edema will come, and developing more fluids, and the edema, the lymph is too enlarged. Maybe they may think that the disease will be spreading from the cancer. Maybe after we all know that after the cancer surgery of the breast, the patients can develop lymphedema in their upper limbs. Okay, upper limbs, that means if the patient is having the they remove the right breast, so they can develop lymphedema on their right limb. Okay, so after after removal of breast, gradually the lymphedema will be developed. Okay, so that is also main problem, main things. In the early stage, we can teach the caregivers and the patients how to prevent lymphedema. So we know after removal of breast, the patients they could develop lymphedema. So you have to treat in advance. Okay, you have to give an adequate explanation to the patient and caregivers how the edema develop. So how to prevent lymphedema development. So these all things you have to teach earlier also in the post-operative period also. Okay, so if they are not taught well, they may think that the disease will be spreading from the cancerous area to the non-cancerous area because the fluid accumulation. We know this is not a spreading. This is because of the removal of the adjacent lymph node. Okay, so that kind of explanation should be there for that patient. And social isolation. Nobody is willing to expose their limbs in the society, and social isolation will be there. Social that friends or relatives are not willing to see this type of patients sometimes because of misconception. And as I said, constant reminder of disease. Disease is very important point. Always they might be thinking that okay, my disease is spreading from the that cancer area to the non-cancerous area. That is why I am having that edema in my lower limbs or upper limbs. So how to manage? So this is also important. So first you have to decide whether the patient is having lymphedema or not. So that part you can take a good detailed history taking, and along with that you can do the clinical assessment. Then you can finalize whether the patient is having lymphedema or not. So after diagnosing lymphedema, you have to manage 4 the principles. One is skin care. The first one is skin care. The second one is massage. The third one is compression bandaging. The fourth one is exercise. These are the 4 principles which we can apply for lymphedema patient. And intermittent pneumatic compression pump is also there. If the patient is having stage 1 lymphedema, you can do intermittent pneumatic compression pump. So if the second stage or third stage edema there, if you apply continuous pressure on that area, and that means the intermittent pneumatic compression pump you apply. So there is a lot of discomfort and pain will be developed. So better you can use, if you use intermittent pneumatic compression pump, you can use it in the first stage. So come to the skincare part. So before moving to the skincare part, I'll just tell you how to take a measurement. So we know there is a one lymph will be affected with the lymphedema. The other lymph is normal. Okay. So whenever you take the lymphedema measurement, you have to take both lymph measurement. Okay. Then only you have to find out that how much edema is increased in the edematous area. Okay. And so when you take the measurement, you have to give a comfortable position to the patient. And from the upper part, you can take the first you can take the measurement from the tip of the ulna plus that head of the ulna, not tip, head of the ulna plus 2 centimeter. You can mark there first. From the marked point, then you can mark every 4 centimeter. Okay. So From the head of ulna plus 2 centimeter, you can mark first, then every 4 centimeter. In the lower limbs, again, you can give a comfortable position to the patient. Here you can see from the medial malleolus plus 2 centimeter, then again 4 centimeter. Okay. So these are the, this way we can able to, you can mark first and then take with the help of that measure, the inch tape, you can take a measurement circumference. So coming to the skin care, always you have to tell the patient to apply simple moisturizing cream. If moisturizing creams is not available, they can apply coconut oil. And keep the skin clean and dry always. Meticulous drying between the digits. This is also important. Whenever you see these type of patients, you have to teach the importance of cleaning and drying between the digits, because there is a chance of accumulation of dirt into the digits. So if you not treat it well, there is a chance of developing fungal infections. And avoid injections and venipuncture. Here, if you give injections or venipuncture that area, there is a chance of developing infections. We understand that if there is any damage into the lymphatic system there, the patients could develop lymphedema. So there is no lymph nodes and lymphocytes are there for preventing infections. So try to avoid injections and venipuncture. So if there is a that infection or cellulitis develop, it's very difficult to heal. So try to avoid injections and venipuncture. Avoid blood pressure cups also. So if you apply blood pressure cups also, that the patients may feel very heavy and very pain that affected area. So they are feeling very what it calls numbness, that sort of feelings. After that they tell us. So kindly avoid applying blood pressure cups and injections and venipuncture. Avoid injury. So try to avoid injury. If there is sometimes if they are working in the kitchen, it might be happen. If there is a small injury there, they'll keep it clean and dry. If there is a signs and symptoms of inflammation, that means redness or any the signs there, you can refer the patient or advise the patient to take medical advice, and they could take one course of antibiotics for that. So otherwise, so there is a chance of developing cellulitis. So that is also very, very important. Try to avoid carrying heavy things, because if they carry heavy things, what happen? Their arterial capillary circulations will be improving. So if there is a arterial capillary is functioning well, there could be a chance of developing edema. There is definitely the fluid accumulation will be there. If they do, they carry heavy things, so more accumulation of fluid into the interstitial space. So try to avoid carrying heavy things and avoid that hot bath also. If you take a hot bath, so again the dilatation of blood vessels will be there. So again there is a chance of developing edema more. So come to the massage. Here we can do massage in two ways. One is manual lymphatic drainage. The second is simple lymphatic drainage. Now we understand that there is a damage or any failure in the lymphatic system can develop that part, can develop lymphedema. You can imagine. So left limb is affected with the lymphedema. The lymph is larger than the normal. So definitely we can that from the lymphatic from the interstitial space, the lymphatic capillaries will be collecting into the lymph fluid, but in my axilla, there is no lymph node. Okay, so there is no way to both the lymphatic fluid from the lower limbs to upper part of the upper chest. So we have to give a edema, the simple edema for moving the fluid from the lower part to upper part. So that we call it as manual lymphatic drainage or simple lymphatic drainage. So manual lymphatic drainage, one of the trained persons, like one of the nurse or a physiotherapist can do. We know how much pressure is applied. If you apply more pressure on that area, again capillary filtration will be increasing and developing more edema. So if you are not, if you teach this massage to the caregivers, they don't know how to apply how to do the massage and how much pressure is applied. So one of the trained persons will be doing the massage. We call it as manual lymphatic drainage. Okay, and if you after the manual lymphatic drainage, we can teach the caregivers how to follow. So they are not able to massage the affected area, but all other things they can do. So they are not able to, the caregiver or a volunteer is not do the massage on the affected area. So they can do all other things because they don't know how much pressure is applied. So what are the steps? Start with a deep diaphragmatic breathing. Okay. So we during the class I told there is 600 to 700 lymph nodes in our body. So if you do the deep diaphragmatic breathing, all lymph nodes will be stimulated. And if you push fluid from the edematous area to the non-edematous area, the fluid, the extra fluid will be collected. They are ready to collect the extra fluid. Wherever the extra fluid is collected, they will be ready to collect. Okay, so they will be ready to absorb. So that is why we ask the patient to take deep diaphragmatic breathing. After that, you can stimulate the unaffected lymph nodes of the region of the body are treated first. So that the thing is, there is no lymph node in our affected limb. Okay, so you have to treat, you have to stimulate the unaffected lymph node of the lymph node of the unaffected side. Okay, see, if I am having, if you can imagine, if I am having lymphedema in my left hand, you have to stimulate in my right axillary area, because in my left axillary area there is no lymph node, where the surgeon was removed during my surgery. Okay, so adjacent lymph nodes is also removed during my surgery if I am diagnosed with the cancer breast. So for that patient, you have to stimulate the unaffected side of lymph node first. Then you can move the fluid from the proximally to distal. So you have to give pressure, the small pressure from the, you have to clear the proximal area first and then go to the distal area. Okay, so you have to move the fluid from here to here first, and then from the chest area there are a lot of lymph nodes and lymphatic capillaries are ready to collect the extra fluids. So our duty to move the fluid from the affected areas to the non-affected area. Okay, so you can do slow and rhythmical movement and use gentle pressure. So this is the way to do the massage. So if you do the manual lymphatic drainage, you can do the you can stimulate the superficial lymph nodes also. After taking deep breath, you could massage the superficial lymph nodes like periauricular lymph node and submandibular lymph node and supraclavicular lymph node. After that, you can stimulate the unaffected area, unaffected axilla first, and then go to the affected area. Affected, not axilla, affected area part. You can massage the area from the proximal part to distal part. Okay. So here there are few contraindication if there is a congestive cardiac failure there. So these patients you could not do the lymphedema massage because the fluid overload. If you massage fluid from the edematous area to the non-edematous area, so there could be a chance of fluid overload and developing. Sometimes the patients will go to the congestive cardiac failure. So, so if there is a cardiac issue there, better you can don't do that lymphedema massage. And acute inflammation caused by pathogenic germs like if recurrent cellulite is there, so you can try to avoid that time. So after the control of infection, you can do the massage. And acute renal failure also. Here also there is a chance of developing fluid overload and acute deep venous thrombosis, deep vein thrombosis. These are the contraindications for doing massage. So before come to the after the massaging, you can do the bandaging. So you can do first you can do spiral bandaging. After 2 weeks, you can advise the patient to do the follow-up. If the patient is tolerate the spiral bandage, then you can move on to the multi-layer bandaging or a figure of 8 bandage. Okay, so our aim is to compress the bandage with the help of compression, so the fluid will be goes up. Okay. So here from the axilla, from the limbs to axilla, there is a chance of accumulation. If the fluid is reaches upper than the area, so definitely the normal lymphatic capillaries and lymph nodes will be absorbing the lymphatic fluids. So here you can see that legs also, if the patient is having lower legs edema also, the treatment could be the same. You can advise the patient to wear the sleeves also. So if there is a edema is unilateral, they can use the compression sleeves. And also they can do compression bandagings. So after that, you can advise the patient to do exercise. Could be gentle and regular. So if you do the exercise, we can prevent stiffness, and you can encourage normal activities, not taking that heavy weights and all. So range of motion exercise you can advise, and if the patient is not able to do exercise on of you or the caregivers could do the patient exercise. They can also help the patients for doing exercise. So I already said intermittent pneumatic compression pump. So it is a electrical air compression pump attached to the you can see that picture. So inflatable plastic garment that is placed over the affected limb. So this it looked like that spicmom and the BP apparatus cough. So that affected limb you can put into that sleeve. Then you can you can adjust the pressure. Usually 30 to 60 mmHg pressures will be start with a 30 to 60 mm pressure, and duration you can set duration 30 to 120 minutes. So after that, they can able to read their books when the treatment is going on, if the patient is okay. So if they have any difficulty or pain or distress there, you can stop it, and then you can treat that problems first, and then you can do the treatment. Complications of lymphedema. One is cellulitis. So this is acute inflammatory episode. So we all know that what are the signs and symptoms of inflammation. So there is redness, warmth, pain, all those things, symptoms will be there. So if there is a cellulitis there, they have to take a good treatment. Okay, could be streptococcal usually, but sometimes so staphylococcal infection is also there. So if there is a pain, swelling, warmth, redness is there, you can sometimes maybe sometimes it could be lymphangitis, and also lymphedema, lymphadenitis also there. So it could be a chance of developing blisters. So that the patients will experiencing fever, headache, and vomiting also. If these signs and symptoms there, better you can refer the patient to the physician and take one course of antibiotics, especially amoxicillin. This is the good drug for controlling these type of infections. And if there is a cellulitis there, you should not do the massage or bandage. If the patient is having cellulitis, you can take good treatment for that. And after the infection is controlled, you can do the management like massaging or bandaging. So come to the lymphoria. The main complication is lymphoria. If you are not treat the lymphedema area, there is a chance of leaking of fluid from the lymphedema area. That is lymphoria. So leakage of lymph from the edematous lymph. That is lymphoria. So here the management is you can apply non-adherent dressing to the leaking area and apply pressure bandage. So this way we can able to manage. There is no contraindication for applying the bandaging, crep bandage for lymphoria patients. You can able to apply apply crep bandage for lymphoria patients so that all extra fluids will come out. The one thing you can do is you can apply one that non-adherent dressings like Gamcipat first on the lymphoria site, and then you can apply crep bandage. So we can watch a video on how to, this is not a final video. We are in the process of making lymphedema management video. So we can show that video, lymphedema part 1 and part 2. So then I'll take few questions. Anybody have any questions regarding this class? Please ask. So one thing, so nowadays the literature said there is no need to apply the moisturizing cream during the massage. So it will be affecting the friction. No, if you give a pressure, your rhythmic movement, if you apply the gentle pressure for after your gentle pressure and rhythmic movement, the fluid will be able to move, no, from your the gentle pressure. So if you apply apply moisturizing cream on that part, that grip is not there, not move the fluid freely. So that is the studies show. So we stopped applying moisturizing cream during the massage. Any questions? Yes.
Hello,
Yes. Sunny.
ma'am. I wanted to ask regarding this, for the dressing for the edema. Some of the time, we apply this MgSO4 and glycerin matchup dressing. So, is it, applicable to this case? Or
Can you repeat? Can you repeat again?
many a times, we do apply magnesium sulfate, MgSO4 plus glycerin. That is
Oh,
glycerin matchup dressing to
yes.
reduce the swelling. Fitting edema or non-fitting edema for both we are using. So is it applicable over here? What exactly study says? Because I never get a chance to, interact with such other state practices and, people. So this is the right platform to ask from many people are from the different regions and different hospitals. So maybe I get the idea that
Okay. Thank you. Thank you, Sunny, for asking that question. So here it's a lymphedema. You are asking an application of glycerin maxil, right?
yes.
Yeah. So if there is a abscess formation, there is a signs and symptoms of developing abscess formation there, you can apply glycerin maxil. Here entirely different. There is a edema related to lymphatic system failure. So there is a accumulation of fluid will be in the interstitial space because of the deformity, or there is any damage or any problem in the lymphatic system there. So the accumulation of fluid, that is lymphedema. No. So if you apply glycerin maxil for that area, it could not help. So you have to move the fluid from your own pressure. While you apply pressure, that fluid will be moved from the interstitial space without without massaging or without applying bandage. Is no way to control that edema. It's not a one-time edema formation. It's a whole day. If there is a damage into the lymphatic system there, whether there is a inguinal node or the axillary node, if there is a inguinal node failure there is a chance of developing lower lymph edema. So if there is a damage in the upper part of lymphatic or axillary node lymphatic system failure there, so there is a chance of developing upper lymph edema. So there is no stop process. It's a continuing edema formation will be there. So you have to do the continuous massage and exercise and bandaging for that patient.
Yeah, ma'am. True, but sometimes, applying pressure, as you mentioned that by giving the pressure, we can reduce the accumulation of fluid. Okay?
Yes.
Yeah, but sometimes it is really painful process. So how can we minimize the pain?
Yeah. If the patient is having pain, you have to give a good pain management first. So if there is a cellulitis or any otherwise, if the patient is having you have to find out whether the patient is having nociceptive pain or neuropathic pain first.
Yes.
Then if the patient is having nociceptive pain there, you have to treat, go with our WHO analgesic ladder, or if the patient is having neuropathic pain, you have to give some tricyclic antidepressants. Okay. So some kind of adjuvant drugs and control the pain first and then do the massage. If you do the massage, you have to apply only gentle pressure. You have to apply gentle pressure. If you apply more pressure on that area, there is the chance of that accumulation of fluid lot more there, because if there is a arterial filtration there is a chance of developing edema. If you apply more pressure on that area, what happens? Again, arterial filtration will be more. Okay. So you have to apply only gentle pressure. Your gentle pressure is enough to move the fluid. So if the patient is having pain, you have to treat the pain first and then you can do the management.
Yeah, because many a times it has been seen that in cellulitis patient, pain
Yes.
intensity is too severe. So even the patient let us touch the foot feet also. So at that time, it gets worsened while applying or massaging the foot or particularly upper limb. So patient gets worsened the pain. That is why.
Yeah. Definitely, if the patient is having cellulitis, you have to treat with antibiotics. After the antibiotic, maybe one course of antibiotics, it can you can able to control the cellulitis. So if once the cellulitis is controlled, the pain will be reduced. So after that, you can teach the patients and do you can manage the patient for lymphedema.
Yeah, ma'am. Thank
Okay.
you.
Thank you, Sunny, for asking that question.
Thank you giving for the satisfied answer, ma'am.
Okay. Any other questions? Anybody? So I already said there are two complications. One is cellulitis and the another one is lymphoria. If the patient is having cellulitis, you have to assess well and refer the patient to the physician and take advise the patient to take one course of antibiotics. Make sure the patient is taking the prescribed antibiotics. So after that, you can do the management part. Before that, you should not do the management. If the patient is having cellulitis, definitely the patient is having pain, discomfort, and so many problems related to infection. So definitely you have to treat with antibiotics, and after that you can do the management part. And for the lymphoria patients, so you can do the bandaging because there are oozing out of fluid from the lymphedema site. You can manage the patient with the application of crepe bandage. So before applying crepe bandage, you have to apply one roll of cotton gauze on the lymphoria site. Then you can do the crepe bandage. You can apply the crepe bandage because of your that crepe bandage pressure, that fluid will come out, so that we can able to reduce the edema. And also suggest the lymphedema sleevings, also lymphedema that garments. So so if they are using that type of garments, the lymphedema, that type of stockings there, lymphedema stockings there. So better they can remove the stockings at the during the night time, because during the sleep they don't know how much edema is reduced. If the edema is reduced, so that the stocking is the elastic bandages. Based on the reduction of edema, that the stockings will be the elastic type of stockings will be compressing the blood vessels. It can be that affecting the circulatory system. Okay, so better they can remove the stockings during the sleep time. So if you don't have any questions, we can wind up the sessions. Thank you. Thank you for all joining and attending the session. Thank you, Sunny, for asking the question and clarifying your doubts. Thank you all. We can see you in the next week.
Thank you.
Thank you, Sheeba ma'am. Thank you everyone for joining us. Please do leave your feedbacks because it is very important for us for our improvement. So with that note, this is Sri Priya along with Sister Sheeba signing off from the Tips Echo Desk. See you in the next session. Till then, everyone take care. Stay safe. Be happy. Bye-bye.